Welcome to this educational program. This module discusses ways to lower the risk of developing age-related macular degeneration, or AMD. Other modules are available that discuss specific details of the evaluation and treatment of AMD. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. However, it may not necessarily reflect the experience of your surgeon or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Any mention of drugs or medical products does not necessarily imply their endorsement. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or skip through them in any order you wish. Age-related macular degeneration, or AMD, is an eye disease that causes vision loss. It affects a part of the retina at the back of the eye called the macula. There are two types of AMD, so-called dry AMD, or early stage, and wet AMD, or advanced stage. A risk factor is something that increases susceptibility to disease. Some factors can be modified, while others are fixed. It is possible to reduce the risk of disease by modifying those factors that we can control. Researchers still do not have a cure for AMD, nor a perfect way to prevent it. Until a cure and prevention are found, delaying the disease and lowering risk are the critical strategies for preserving vision. AMD is multifactorial, meaning that multiple risk factors contribute to it or are associated with it. This figure shows some of those risk factors. We will describe each in detail, beginning with those factors we cannot modify. The risk factors that we cannot control are age, sex, family history, genetics, eye and skin color, and extreme near or far-sightedness. Age is the primary factor for developing AMD. Anyone aged 50 or over is at risk for developing the disease, and the risk increases with age. While signs of AMD are present in only 14% of people aged 55 to 64 and 20% in people aged 64 to 75, they are present in up to 37% of people over 75. It is thought that AMD is an accelerating aging of the eye. The cells in our eyes naturally diminish over time, but in macular degeneration, this loss is sped up. A higher number of women than men have AMD. Some research also indicates that women with early onset of menopause may be at greater risk. AMD appears to be hereditary. Having relatives with AMD makes us 4 times as likely to develop the disease. Those who have parents or siblings with advanced AMD seem to develop the disease quicker and at a relatively younger age. The fact that AMD may be hereditary means that a gene, a unit of DNA information inherited from our parents, may predispose us to the disease. A gene called complement factor H, or CFH, has been determined to be strongly associated with a person's risk for developing macular degeneration. Therefore, individuals who have this CFH gene are more likely to develop AMD and can pass this gene on to their children. There is ongoing research to find genes linked to AMD and to find ways to alter those genes through genetic therapy. AMD is more common in people with blue eyes or light skin. Blue-eyed individuals have less protective pigment in their eyes. Pigment is the material in cells that absorbs light, so less pigment makes these individuals particularly prone to ultraviolet light damage. Pigmentation in the eye is related to pigmentation in the skin, and thus lighter-skinned people also have a higher incidence of AMD. Nearsightedness, which means having too long an eyeball, or farsightedness, which means having too short an eyeball, may have an effect on the retina. Risk of developing AMD may be increased as a result of extreme distortions of eyeball shape. If an individual already has AMD in one eye, the chance of developing it in the other eye is greater. Also, Dry AMD in one eye may predispose someone to wet AMD in the other eye. The risk factors for AMD that we can modify include smoking, diet, obesity, blood pressure, hardening of the arteries, and sun exposure. Smoking is a strong risk factor for developing AMD. In fact, smokers are 6 times more likely to develop AMD than non-smokers. Even former smokers have an elevated risk. Smoking impairs the body's circulation, decreasing the flow in retinal blood vessels. The tobacco in cigarettes also appears to interfere with the body's absorption of lutein, an important molecule called an antioxidant that protects the eye from damaging UV light. Smoking also increases blood pressure, another risk factor for AMD. And finally, it increases free radicals, which are highly reactive molecules that can damage the body and speed up the onset of AMD. There is also a strong link between nutrition and the development of AMD. It has been demonstrated that people with diets high in fruits and vegetables, especially green leafy vegetables, have a lower incidence of macular degeneration. Eating nuts and fish is also thought to help AMD patients. In addition, supplementing the diet with high levels of antioxidants and zinc has been shown to significantly reduce the risk of advanced AMD. Antioxidants and zinc are found in the retina, and it is thought that people with AMD might actually have a deficiency of these. Conversely, a high fat intake, including red meats and high-fat dairy products, is associated with an increased risk of macular degeneration. Obesity means having a body mass index, or BMI, of over 30. The BMI is a calculation based on height and weight. The range of BMI is from around 15, which is near starvation, to over 40, which is morbid obesity. Several studies have reported an increased risk of AMD with increased BMI. If the BMI is 30 or more, the likelihood of developing advanced macular degeneration increases by about 2.5 times. High blood pressure is also called hypertension. It has been shown that people with hypertension are 2 to 3 times more likely to develop advanced AMD than those with normal blood pressure. Since new abnormally weak blood vessels are formed during advanced AMD, controlling blood pressure is important for preventing those weak blood vessels from leaking. Often called the silent killer, there are no symptoms of high blood pressure. The only way to know you have it is to get your blood pressure checked regularly. High blood pressure can be controlled by modifying lifestyle. Another possible cause of retina damage is the hardening of the arteries that supply blood to the retina. As the arteries harden, the retina does not receive enough of the oxygen and nutrients it needs to function optimally. As a result, vision loss ensues. Atherosclerosis is a dangerous cardiovascular condition, but may be prevented or slowed down through diet, regular exercise, and other lifestyle changes. Both ultraviolet or UV light and visible blue light may damage the retina. The relationship between light exposure and AMD needs further study and consistent results. Nevertheless, it is extremely important to protect the eye from light damage. Sunglasses can protect the eyes from both light and heat. There are actually sunglasses designed specifically for individuals with AMD. When looking for sunglasses, look for ones that screen 99 to 100% of UVA and UVB rays, and even better, ones that also protect against blue light. Your optician can check your glasses to measure their UV protection, and you can also have your own glasses treated to give UV protection. Diet can also protect the eyes from light damage. The antioxidants, lutein and zeaxanthin, either from green leafy vegetables or through supplements, are thought to filter light and help prevent macular damage. There may also soon be an implantable lens for the eye that blocks harmful light. Ask your eye doctor about this option. Taking all of this information together, It is clear that it is possible to reduce some risk of developing AMD. Begin by speaking with your eye doctor and familiarizing yourself with the risk factors for AMD. You are already taking this first important step of education by viewing this program. If needed, take steps to change modifiable risk factors through lifestyle changes. Include vitamin and nutrient-rich foods and add any needed supplements for optimal retinal health, such as lutein and zeaxanthin. Also, reduce dietary fat. Have regular eye exams. This will help your doctor diagnose problems at their earlier stages. Monitor your vision daily and watch for changes in your vision. Always protect your eyes outside with sunglasses. Quitting smoking is vital. Finally, try to get regular exercise. Physical activity that works up a sweat, done at least 3 times a week, has been shown to reduce the rate of progression to advanced macular degeneration by 25%. This concludes our presentation. We invite you to view it as many times as necessary. Other modules are available in this series, including Understanding AMD, Dry AMD, Wet AMD, and Treatment of AMD. There are numerous resources to educate you and help you cope with AMD. These are just a few of them. You may also find these sites to be useful. We hope that this program has furthered your understanding of ways to lower the risk of developing age-related macular degeneration. We wish you the best for the future, and thank you once again for viewing this educational program. Age-related macular degeneration, or AMD, is an eye disease that causes vision loss. It affects a part of the retina at the back of the eye called the macula. There are 2 types of AMD, so-called dry AMD, or early stage, and wet AMD, or advanced stage. A risk that discuss specific details of the evaluation and treatment of AMD. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. However, it may not necessarily reflect the experience of your surgeon or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Any mention of drugs or medical products does not necessarily imply their endorsement. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or skip through them in any order you wish. Risk factor is something that increases susceptibility to disease. Some factors can be modified, while others are fixed. It is possible to reduce the risk of disease by modifying those factors that we can control. Researchers still do not have a cure for AMD, nor a perfect way to Welcome to this educational program. This module discusses ways to lower the risk of developing age-related macular degeneration, or AMD. Other modules are available,